letting me come and talk to you, I think is the first thing to say. So when I was starting to write this talk and think about this, I was thinking, I think the last time I stood up in front of an audience and presented something was actually to the last MS nurses at the Limits, which I think was just as everything was starting to kick off, and sort of said, this thing's coming, and it's coming in the next couple of months, and here we are 18 months or more further on, and we got there in the end, despite global pandemics and everything that the world threw at us. So what am I here to talk about? So it's a UK-wide MS pregnancy register. And when I was here last time, I talked about why care and knowledge around pregnancy and MS is important. And I think, as Del alluded to, it's more important now than ever so. I think particularly our pregnant women have been poorly served during the pandemic. They've been very isolated from both MS care, and they've also been isolated from pregnancy care. And it's been a really traumatic time. But during this time, actually, more and more information has come out around MS and pregnancy. And it's a really exciting topic to be involved in. And it's a really exciting time to be involved in this topic, because there is a real opportunity to improve things. So if you'd asked me 2 years what we were doing, what the vision was, the idea was to try and collect real-world data from women living with MS who were also pregnant, and to try and inform, number one, our knowledge around what we're doing in the UK, potentially move towards more standardised care, so that actually, it becomes a resource whereby if we know what other people are doing, actually care moves forward. But also to improve our knowledge, particularly around aspects of pregnancy that are less well studied. There's lots of pharmacovigilance studies looking at MS drugs and pregnancy, but actually there's more to pregnancy than just DMTs in MS. There's huge questions around fertility, around IVF, around assisted conception, around pregnancy losses and termination, around breastfeeding. The list just goes on and on and on. And if you speak to women with MS about this, the list gets even longer and longer and longer. But these things have to start somewhere. So what have we started? Well, we started this register. It collects data directly from women with MS. So it runs alongside the UK MS register, and actually asks the women to go in and fill in their own information. So there's no long case report forms for people who refer patients to this. And I think this is really key when you're trying to implement something in clinical practice, that actually we are all busy, we are all on our knees clinically, we're all doing so much for so many people, that actually having something that allows really a minimum amount of data to come from the clinicians and so much more from the women is beneficial. We're asking women to complete 2 questionnaires during pregnancy, and then 2 in the first year postpartum. So there's a questionnaire when they register, which can be at any time during pregnancy. They register particularly late, it's actually only 1 questionnaire, and then a second questionnaire around the 24-week mark. And then 1 at 3 months postpartum and 1 at 12 months postpartum. And through these questionnaires and through the rest of their MS data, we're trying to gather data on DMT use around pregnancy. So not what we think happens, but what actually happens. And certainly in my clinical practice, I've had women who sort of rock up to clinic pregnant and then tell me what they've done about their DMT. I think it's getting less common, but I think we really need to know actually what's really happened. The outcomes in the mother and baby, breastfeeding, postnatal disorders, and also things like fertility treatment around pregnancy. But really, the idea is to develop alongside this a resource for information, so somewhere that women can actually go and get reliable information. And with a lot of the work that I've done with women, they don't know where to go. They all go to this Facebook group, Mums in MS, and I'm not on that Facebook group, but I've heard what comes out of it, and I think it's sort of a variable quality. I think it's great as a support group. I think it's got a huge amount of value. But really to try and overcome some of that people turning desperately for information because they don't know where to find anything, and then getting misinformation or rumours. So actually to develop a resource whereby people can turn to, know that they're going to get reliable information about the safety of DMTs, around what information there is around there, maybe about assisted conception, around breastfeeding. So actually it's all collated in one place. And I think what's been really helpful about the guidelines that we wrote a few years ago now is actually the way that they have been shared amongst women, so that they are able to go and reliably share information amongst themselves to try and combat that. So who's involved in it? It's a bit of a rogues gallery, I'm afraid. So this idea all started in 2019, so a little while ago. So there's some neurologists that hopefully some of you will recognise. I'm there. David Rogg, Stella Hughes from Northern Ireland, Katie Murray from Scotland, Peter Brex from London, and Owen Pearson from Wales, along with 2 representatives from the MS Register, and really trying to develop this idea and learn from the epilepsy and pregnancy registers and actually what they have done for women and how they've managed the setup. And then we brought in 2 MS nurses as well, realising that actually MS nurse representation was really absent. And from talking to Sarah White, who I'm not sure is in the audience, I know her name's on the list, but I'm not sure she's quite here yet. She sort of bit my hand off and said, yes, I'll be involved. And then Nicola MacLeod, who's from Scotland as well. So we've really tried to cover the whole of the UK to get good representation. And then Helen Ford in Leeds has also joined us. So it's a group of neurologists. We've had a couple of in-person meetings. We've got another in-person meeting in a few weeks, actually, who all feel similarly passionate about improving the care of women with MS. And I think one of the things that I'm really clear about is this is not my project. This is a community project. This is something sort of that's being developed across all the UK nations, and actually is for the good of women with MS. So if anybody has ideas for projects they want to do, for data they want to get out, that's really there for the taking. It's not something that's exclusive, it's something that's inclusive. And why is this needed? So I talked about this a little bit at the start, but just really to come back on this, there's a real lack of information. And actually, when we started the idea 2-3 years ago, there was even less information. And actually, most of the existing work focuses purely on DMT safety, which, as I said, is a part of this, but not the whole part. We don't really understand what support women with MS need. And actually, if you go out and talk to women with MS about what support they need, it's quite varied. But a lot of them want information and a plan. They want to be not in charge of their care, but have ownership of their care, but not to feel like it's all pushed onto them. Many of our women with MS who are thinking about pregnancy, they see a midwife who goes, oh, I've never seen anyone with MS before. Oh, aren't you in a wheelchair? And sort of have, are faced with that very instinctive response from their obstetric team and end up having to deal with that on their own. I think where I work, I'm quite lucky. I'm in a big teaching hospital. The obstetricians have a joint obstetric neurology clinic, but I'm very aware that that's not the case in for most women. I think they end up becoming quite sort of divorced from a lot of their care and losing a lot of the choices that they should have. It's really difficult to capture the balance between the need for DMT and safety during pregnancy, and I think Wallace touched on this in his talk around that careful balance and actually giving women the information to try and support them in conversations with MS nurses, with obstetricians, to try and build that and to try and build the evidence as well. And as I mentioned earlier, issues such as assisted conception, breastfeeding, mood disorders are rarely studied. My least favourite question is around assisted conception because people ask me, and it's so complicated, it's such a minefield, and there's so little information out there that we desperately need this because obviously it's an area that's of massive emotional importance to women and has assisted conception has massive physical implications for them as well as the emotional side. And actually, if you go and look for studies that have assisted conception in MS, there's a few, about 5 or 6, it's very little. And the same is true for pregnancy loss. And just because it's hard to study doesn't mean we shouldn't study it. So I'm hoping that we'll be able to, we can never answer all these questions, but provide information that really helps to contribute to those. And so how do people take part? So we have a website. I've got loads of post-it notes and lanyards left upstairs by coffee, so you can all get a nice lanyard like this to remind yourself where to send people to register. So the women register, you don't have to do anything, you don't have to consent them. The consent is all online. Actually, if you Google UK pregnancy register MS, it comes up as the first hit because there's nothing else really out there doing the same thing. So it's very easy. They go onto the website, they have a consent form, they have access to consent, all the information forms and consent forms before they make any decisions. And then, as I said, it's a couple of questionnaires during pregnancy and a couple afterwards. And where things are tricky, if women, if there are problems with the pregnancy, they don't want to answer any more questions, then they always have the option to leave and leave contact details for either their GP, their obstetrician, other people, so that we can contact them and get that important information. So what we'd anticipate is that where things have gone simply and well, which is often the case in most pregnancies, actually the woman would go and do all of the data collection themselves and feed it back in, but we have a backup option for where things have not gone so well so that we're not causing distress to these women. So I'm going to stop there, but I'm happy to take any questions either now or I'm going to stick around for coffee.